Hey everybody, thanks for joining us. Tonight is Q&A, and you can ask questions about anything, your clients, your family, things you just want to know. Go ahead and fire away. You can unmute yourself or type in.
And go ahead, Megan, then Chris.
Hey, Megan.
Hey, Greg. It's a product healing question. I had a possible client reach out who has ALS. Of course, they want to know what the possibilities are. Is that something that I can say is possible to be completely resolved, or should I say partly resolved, and what do you think is like a reasonable ballpark timeline?
That's a super chronic health issue.
Yeah.
In
It's
anything
tough, and so I don't.
that,
Yeah, I just want to give like a good kind of expectation going in. Like they want to.
expectation of what?
If chronic healing can resolve ALS.
I've never seen it happen.
Okay.
You can slow it down. You can resolve
down.
some of the issues. You can slow down the degeneration.
Okay.
That's about the gist of it.
Okay. Would you say like to help like lymphatic flow and to help the nerves to have more, sort of
Honestly, with a condition like that, you have to evaluate like what's going on. Like, for example, there's a lot of things that are degenerating, and a lot of times there starts to be respiratory distress where they have a hard time like laying in the bed. They end up sleeping in a chair. And so you kind of have to assess where they're at and then start addressing issues that are specific to their degeneration. Respiratory function is usually one of the first things that I would look at for that condition, and try to keep them breathing as healthy as possible given the condition. But it's just a lot of damage control. So there's not really a template to go through. You have to kind of treat and then reevaluate. It's not just chronic, and it's very complex, and there's not a simple like protocol for it. Like, it's probably 15 different protocols that you'll have to rotate through.
Okay.
Yeah, like 12 to 15 probably. I want to say when I was treating it, I mean, I had several people that I treated and we were able to slow it down, but I remember counting like the different protocols, like which one am I using? And it was like 12 or 13, 14, something like that. I mean, it was a lot.
Okay. And that was just chronic healing protocols or also essential work?
Yeah, like because of the respiratory distress, I didn't really do a lot of oil work with them. Something like that, it's a kind of a case by case basis, but the level that the body degenerates and what stage, like the degeneration continually accelerates. And even with oils and everything like that, you're constantly having to kind of assess like how things are accelerating and then just treat it appropriately. I mean, part of what you can provide is quality of life, but
Okay.
yeah,
Okay.
that's about it.
Okay. Well, yeah,
I mean,
that
I always hope
can.
for a miracle. Like I always hope
Yeah.
for a miracle, but definitely I wouldn't make any promises, and I definitely would not give them any timelines.
Okay.
Like
That,
no timelines.
I just
at all.
want to have an honest conversation. So
Yeah.
okay. Thank you.
How progressed is it?
He was diagnosed 2 years ago.
Oh, so it's early stages. Yeah, I mean, you could actually probably slow things down quite a bit, but it's going to be constant work, and it's not going to be something where you get it to the point where you go, oh, we can slow down with treatment. If anything, treatment will accelerate as the condition accelerates.
Okay.
Yeah.
All right. Thank you.
And then go ahead, Chris, then Sandra.
Hey, Chris.
Oh, thanks, Sam. Hey, Greg.
Hey.
A short I'm trying to help this person.
Mhm.
She's my client and she wanted to buy the human design oils. She said she's a manifestor generator.
Mhm.
Is there like a short way to explain this to her and that which oil set she needs to work that?
Yeah, I'm gonna turn that over to Samantha a little bit more than me.
Well, I
Thanks,
mean,
Sam.
it just depends on what she wants to do. So if she just wants to work being a manifesting generator, super.
Yeah.
Yeah,
Yeah.
you can just get the manifesting generator oil. I mean, the book has a great like kind of protocol practice with it. And just it would really allow her to just kind of step into that and connect with that. And if she wanted to go further, and look at more things in her human design, she can do that. But I think Robert probably can just put the links for the manifesting
Yeah.
generator oil.
And the advanced work for any of the types is also assemblage point and etheric chords combined with their type.
Okay, so point her to the I'm sorry, Sam. Can you repeat that again? Which oil set?
It's not even a set. So
Oh.
with the types, with the types, you just point them right to their type, which is
Human
going to be the
design.
manifesting generator. And Robert posted the 5
Oh, he
MMI
did.
and
Thank
the
you,
rollerball.
Robert.
And then, like Greg said, for the advanced practice with just the type, it's with assemblage point. And Greg made it more affordable because assemblage point is a very special oil. So we have it in 3 sizes.
Okay.
And Robert put the most cost-effective size there, that 2 ml rollerball. And then with the human design, we have a special etheric chords therapeutic rollerball to keep it cost-effective for them. So all like what Robert just posted, if she wants to just work her type, that would be the perfect place to start.
Got it. And just point her to the book for the protocol?
For now.
Okay. And I don't know anything else.
I do have it on
Human
the blog.
design.
I actually have it on the blog too. So you can also email me. I can give you a little more.
Oh,
like,
perfect. Thank you.
Yeah.
I might do that. Thank you.
Yeah.
And one more question, please. So Greg, it's the same person. She's the one who had a really rough divorce and
Okay.
so that's been settled, she's doing great until the ex and the new spouse are back in town and now she's finding it hard to function. Maybe projections, I'm not sure.
Like,
But
do you have a little bit more detail? Like what's going on? Like she's having hard time like working?
yeah, she's having a hard time concentrating. Like for example, she paid me twice and two different times. She didn't really owe me anything.
Are they like in her neighborhood or like what's
a couple
triggering?
towns away. So I think she's getting triggered that they're here in Washington.
Hmm.
She's all over the place, she told me, and she's like probably rattled. And I'm thinking maybe there's some projections there, or her body, her physical body's just reacting to them being because of the proximity.
I would give her a galbanum. Like I'd have her inhale galbanum. I'd put galbanum on her wrists. If she could take a few drops of galbanum, and then probably the inhalation of either vetiver or ruscus.
Okay.
And that you might even want to do it in a roller ball so she can inhale it, but also rub it on her arms and legs, like on the joints. And I think that combination could help her. Yeah.
Okay.
Like the vetiver will help get her like kind of a bit more in her body. And yeah.
Okay. Roller ball.
The galbanum will just it would just help her deal with the pain of the situation.
She said she's very angry. So
Yeah.
I told her about the Lang Lang body tonic.
Ling Ling could help, but anger, a lot of times Melissa is the go-to thing.
Yeah, I
for-
told her
if
about
you're not
that.
gonna do any of I mean, chamomile could help, but like Melissa, like when you're really in the middle of being angry, Melissa's
Mhm.
like a godsend. Yeah,
Perfect.
yeah.
I sent her that link.
But like I would say, it's a lot more painful for her than she realizes.
Haha. Yes.
You know what I mean? It's
Yep.
Honestly, I don't think they're thinking about her at all. Like
It's
they're
her.
going on with their lives, and I think even that bothers her. It's kind of weird sometimes. Sometimes people like will have a situation like that and say the couple's really grinding on them and saying things to them. That's upsetting. But sometimes the complete opposite, where they just act like that person's not even in existence anymore, that can be
Yeah.
upsetting, but in a different way. It's
God.
almost like I wasn't even important enough to get upset about or angry about, or you know what I mean.
Mm-hmm.
It's it's hurtful in a different way.
Right.
you know
Yeah.
I there's anger, but like deeper, there's some um there's just some deep hurt feelings.
Yes.
As it kind of unwinds and calms down a little bit, like right
Mhm.
now, addressing trauma, even just with helichrysum, um it might help a little bit, but I would say do the things we're talking about with the galbanum and the ruscus or the vetiver, just to ground her a little bit and ease some of the pain. And if sometimes the anger just passes, but the Melissa can help calm down the anger. And the thing with Melissa is it helps to slow down the generation of lower emotions. And so it doesn't really resolve it, it just kind of stops it. But when
Mhm.
everything kind of calms down and the anger kind of quiets down, there's probably going to be a period where she realizes I'm more hurt than I realized.
Yeah.
And that, I mean, you could keep it really simple with that. Like you could just do some like helichrysum, have her inhale on the heart, have her inhale it into the spine, have her
Mhm.
think of the relationship and that person and inhale it. um I mean, that should help because the helichrysum will help heal the trauma of the situation, but it will help her to move past it. And
Mhm.
sometimes people, I'm not saying this like in a judgy way, I'm saying this like we all do this, like we all do some form of
Mhm.
this, but it's almost like we want some sort of reaction from the other person. We want some sort of validation. We want to see that, even though they've moved on, we were important to you enough at one point in
Right.
our lives that you're upset. And when that
Yeah.
doesn't happen, it feels like doubly bad. Like it's
Right.
just like, all that happened and you don't care. Like, you know what I mean?
You're
Like,
not suffering like
right,
that. Yeah.
exactly. And
Yeah.
we can sit and look at it like an outside observer, but I mean, I've been in that. I've totally been in that. And at the moment, I don't really see it. And then I sit and think, what am I really upset about? And as I sit and I kind of go down the rabbit hole, I'm like, yeah,
Mhm.
they did those things and they just don't care. Like,
Right.
it's like they were dismissive that I'm even a person or that I have feelings or, whatever it is.
Yeah.
And I would say when somebody experiences this, they can be very tender for a while. Like, you know what I mean?
Mhm.
Like they're just any little thing can like just hurt 10 times worse than it does. And it's just because like if you have like a wound in your arm where you know somebody hit you and it broke open and everything, that area is tender for a little while and then it kind of goes away. Same thing happens in the emotional body. You know, it's just they're a little tender for a little bit and they pass, but it usually passes when they start having some positive experiences like, you know, past that, like, you know, oh, they have some friends that are very nurturing, or more importantly, maybe another partner that even if they don't get married, that they start dating and the person really likes them or something like that. It becomes easy to let all that go. But in the
Right,
moment, it's just tender for a little while.
right.
The vetiver, it's grounding. The Melissa strengthens the heart. Like the Melissa, it calms down the emotions, it calms down the anger. And you could say that the Melissa helps a person's heart be able to take a punch. You know what I mean? Like it's kind of like strengthening where something happens and you just are able to go, you know, yeah, that hurts, but you know, move on, right? And the helichrysum helps move past that. But the vetiver is very interesting. You know, it brings about like a peace of mind, but it's almost like it calms down certain processes in the logical mind that just keeps you from going to those dark places. You know what I mean? It's just like you just keep kind of relaxing into it, and it doesn't necessarily take the pain away, but it's just like, yeah, this sucks, but it'll pass. Where sometimes we don't have quite the perspective that it's going to pass. You know, sometimes it just feels like it's just always going to be this way. And the vetiver, you know, it's in India, it's known as the oil of tranquility. And part of that is it has a balancing effect between the logical mind and the intuitive mind. And whenever you start bringing in the intuitive mind, it becomes easier to let go of something. You know, the helichrysum will help let go of something to a certain extent. The galbanum will help let go of something to a certain extent. The Melissa will kind of put them in a place where like, yeah, did it really matter as much as I thought? You know, everything will kind of do it. They're all hitting like different pieces of this. And you know, sometimes you kind of have to tailor like the approach depending on what they're going through. But these particular things for this kind of situation are pretty solid. You know, it's a real solid way to go through and treat this. And the reason to put them on the arms is if the arms have like this certain kind of like agitation in them, like they need to be calmed down way more than we realize, the arms and the legs. Because if you remember, they're part of the basic chakra, and if they're agitated, it becomes harder and harder for the heart to expand. You know, it's harder to transmute lower emotions. It becomes harder to feel a sense of peace. It becomes harder to feel a sense of well-being because you're a little bit like checked out, and you're a little bit it's like you're on guard. You know what I mean? Like you're on guard, and what you're addressing by treating the arms and legs is like a reaction to the difficulty or the conditioning that's happening. You know, a lot of times things happen and we have this kind of automatic response, an automatic behavior that we talked about. And then it goes up and it gets processed, and certain things happen. And then at some point there's like an emotional and mental component. And then the expression of, what do I do about this? Do I run? Do I defend myself? Do I not take action? Do I, whatever, kind of manifests in the arms and legs. It starts to manifest in the voluntary part of the nervous system. And the emotional upset or the mental upset, a lot of times you see that in the arms and the legs. And so if you clean that up, it becomes easier just to and let it go.
Mhm.
And like we were talking about, I think it was on the weekend, that like if you take a little baby and you put some lavender in your hand, which is very soothing to a baby, and you rub it on their chest and abdomen, it actually kind of is agitating to them. But if you take that same lavender and a little bit of lotion and you rub their arms and legs, and then you go touch their chest and their abdomen, they're just like a rag, like a wet rag. They're just limp and relaxed. And it's because when you relax the arms and legs, it allows the torso to drop its defense mechanism, and it relaxes some of the smooth muscle in the gut. And if you think of like what happens when there's anxiety or something like that, a lot of it is tension in the gut, tension in the respiratory tract. And so part of it is tied to these mechanisms. And I talk about it, but I don't go into like boring detail about it, or at least I try not to be boring about it. But
Not boring.
but there's a lot more going on in the arms and legs than what we've even talked about. And so this idea of inhaling the vetiver and rubbing the vetiver on the arms and the legs,
Mhm.
it has a much bigger impact than we think. And in the West, we think so much of like a symptom, like how do you treat this, when really you want to see like, okay, what's happening with the person? How are they getting to the place that they're getting? And how can we go through and look at their mechanisms and calm certain things down so that they just don't go there anymore? It's really more about that than trying to alleviate the symptom of when they hit that spot. And so it's a lot like playing pool, where you're setting up shots to do it. And sometimes it works and sometimes you do need to do adjustments, but those things that we talked about are really solid when somebody is hurt and tender, especially from a broken relationship or some devastating thing that happened to them, where they are experiencing loss. Not so much about the grief part, but just, what do I do now? Like where do I go from now? Because a lot of times, I don't know. We're going down a rabbit hole, but apparently I'm wanting to go down a rabbit.
Let's do that.
But like you look at somebody, you see this a little bit more in men than in women, but like when they're a widower and they really love their partner, right? And then their partner passes, you can see it in their eyes. Like time can go by, everything's fine, they have a good attitude, they're moving on with things, but it's like there's this piece in them that they just don't know what to do. Like they don't like, my life was like this and now it's not. They look a little like kind of lost almost. And women tend to be able to pull that together a little bit better, but it could happen to any of us, at any point when there's some big like loss, or a relationship breaks up and it's been there for a while. It's not just tender, it's just you almost just don't know what to do for a little bit, and you just got to nurse them through that piece, because life will happen. That's the thing, life will happen. Like if you can keep them like from tail spinning too much, eventually somebody's going to like them, something's going to come along, they're going to get some opportunity, they're going to have a group of people that they start interacting with, something will happen, but you just got to get them through that rough patch. And this person sounds like you got to just get them through that rough patch. Yeah.
Thank you, Greg. So
Does that help? Like,
yeah, very much.
Okay.
So between galbanum and helichrysum,
I do helichrysum like probably a couple months from now, like a month or two down the line.
okay, so that's step 2.
Galbanum, Ruscus or vetiver, and if the anger doesn't come down, I mean, I would do Melissa, and I would take it internally if she's up for it. If not, just inhale it all through the day, especially when she starts to have bouts of anger.
Like 4 to 5 drops of Melissa initially.
She could probably get away with 2 or 3.
2 to 3.
Yeah.
All right.
Yeah.
I'm
And
taking that too.
if for some reason, like she needs a little something more or something extra, let me know and we can talk through it. But that
Okay.
should bring her a lot of comfort and a lot of relief.
Yeah.
Yeah.
And so pH, I'm just doing arms and legs and then basic hearts. and
Electric violet on the arms and legs.
Mhm.
Um,
Do I need to blue it?
I honestly, I would I
Mm.
would clean her Mingmen,
Mm-hmm.
as it has to do with like form the intention, and you'll do this with electric violet. Clean the Mingmen as it has to do with change.
Mm.
Yeah,
Okay.
like change and cycles will hit the Mingmen really hard if the person is having a hard time with either one of those. It's a really hard. Yeah.
Okay.
Yeah. Like,
Got it.
you can use an oil for that, but I mean, just cleaning her up should be enough.
Okay.
Like, you already got enough going on. Like the thing with something like this too is, my rule of thumb was to try not to overwhelm them with giving them too many things to do, because they're already in a place where they're a little bit vulnerable, they're a little bit hurt, they feel a little tender. And if you give them this big regiment, at some point they just go, it's too much, and then they'll stop doing it. So like pick a couple of things and then just keep them on track with that.
Okay. Sounds good.
Yeah.
I'm also taking the Melissa because after that huge presentation, my nerves were really
Mhm. How's
raw.
the Melissa treating you,
It's
and how did
good.
the
I
presentation
feel
go?
good. We did the best we could, put it that way. Yeah.
And
we'll
you
see.
performed like you wanted to and all that?
Yes. Yeah.
Okay, good.
Yeah. Yes. Um,
And if they don't do it, then they're just being silly,
right?
right?
I think so too. All right. Well, thank you so much.
You're
Greg.
so welcome.
And then go ahead, Sandra, then Cindy.
Hey, Sandra,
Hi, Greg. Thanks
how are
for
you?
class this weekend.
Oh, good. I'm glad you enjoyed.
Yeah, I did, but I have a lot of questions.
Yeah, I'd love to answer.
Well, the first one is about my husband. He had open heart surgery about 2 years ago, and he physically has not been the same. He had a mitral valve replaced, and he had a maze procedure, which
Right.
is supposed to do away with
Yeah.
AFib. And he's always been an exerciser, and he still exercises every day, but he has all of these symptoms that you have.
Which are what? What are the symptoms?
Reduced exercise capacity, shortness of breath, fluid retention, increased risk of arrhythmias.
Oh, did we put that in the newsletter? Was that the cardiac fatigue?
No, this
Right.
was in the
In the weekend.
yeah. Mhm,
Okay.
yeah.
Yeah.
And also, he feels he has a poor quality of life. And I think he probably does, because he can't do what he always did.
Yeah, he doesn't feel good, and he doesn't have energy to do it. And
Yeah.
he starts to do something and probably has to stop himself. And
Yeah, so he's not taking it well, really well, but I'm not sure I would either. But I was wondering about oils. You had mentioned camphor and rosemary camphor as being really important, but I understood that rosemary can raise your blood pressure. Is that true?
It can a little bit. In some cases, it actually will lower blood pressure. It's not rosemary, it's actually rosemary camphor, which is a different chemotype than regular rosemary or rosemary verbenin. It's usually only used for cardiovascular issues or things to do with like cholesterol and things like that. With cardiac fatigue, I tend to do a rotation of a few things, like I like to use Anula, I like to use Lang Lang, I like to use Melissa. I usually have the person put 6-8 drops of camphor on their wrist, like daily, and they don't have to do them all the same day. But
Okay.
like what I like to do is like every day you're putting camphor on your wrists, and then you're using one of the oils and you're rotating. And at first they might only want to do one, but really more severe cases, like I usually have them kind of rotate through. And I've even been doing a thing with trying to treat chronic blood pressure with going through and doing this. And it's helping, it's working. Like it's not completely getting it to where I'd like the blood pressure to be, but it's dropping it down low enough to where they're in like high normal range, but I'd like to still even get it down a little bit lower. So we're playing with some different little protocols. So I'd like to be able to present to you guys like a protocol that it's going to be a little bit involved, but that you're able to treat a lot of different forms of blood pressure issues with just like a simple template. And given what he's gone through, I would say he has substantial cardiac fatigue. And you could start with just him inhaling Anula if he's wanting. You could do the Lang Lang body tonic on him a little bit,
Okay.
put camphor on him, and then I still would probably have him take like Melissa or Neroli or Lang Lang internally, just like 2 or 3 drops a day, in that combination. And it's not going to happen overnight, but over a period of time, the shortness of breath gets better. It still might be there when he really climbs some stairs or exerts himself, but still his ability to get there is stronger. And if then he becomes more active, that also kind of helps. The other thing that I would say is usually I have them take coenzyme Q10.
He's been
Or
taking
you,
it
yeah, like
for a
how
couple of
many
years.
capsules do you think he takes?
Oh, I don't know. It's a
would- I
pretty
would-
high dose, but I think he takes one.
I would probably bump it up to like 3. Like,
Okay.
you don't have to do it overnight, like bump
Mhm.
it up to 2 for a little bit and then even up to 3. But I know several doctors that they'll say like anytime there's a cardiovascular issue, if there's congestive heart failure, even high blood pressure, that's kind of a go-to supplement, putting them on. Ubiquinol is a little bit more,
He takes that too.
yeah, ubiquinol is a little bit more like
Yeah.
the
That's what
body
he
is able
takes.
to use it better than just regular coenzyme
Yeah.
Q10. It's a form of it. And so with all of that over a period of time, that, I mean, he's had a surgery and stuff on that area, but that should be relatively helpful for all of that. And as he's able to get more active, that should shift it and change it. I mean, there's been a few times where that has not happened when I've treated them, but most times they do become more active. Their energy levels come up and the mood will shift a little bit, but it's consistent treatment over a period of time.
Okay.
Yeah.
Thank you. Can I ask another question?
Of course.
It's about sleep.
Mhm.
One of the things both he and I and many of my clients have, the sleep problem they have is they go to sleep fairly quickly, but they wake up in the middle of the night. And I think one of his problems is he's fatigued because he's gotten into this habit of waking up, getting up, maybe reading a little bit, going back to bed. I don't think that's the healthiest way to sleep. But
Yeah, and when he goes back to bed, he sleeps again, he goes into
he
deep sleep,
sleeps
or
again.
he just,
no, he will sleep again, but there's this anywhere from 1 to 3 hours in the middle of the night that he's awake. I sometimes do that too. So I guess my question to you was, is there an oil that would work best for that kind of sleep problem?
yeah, there's a couple of things. So the one that would probably work the best, I hesitate in saying use it just because he's probably on some other meds as well.
Mhm.
But St. John's wort, usually if you fall asleep, it will help keep you asleep. But the issue is St. John's wort's also a blood purifier, and it will diminish the effectiveness of his medications.
Oh, okay.
And so I would say that would be my kind of top choice, but for him, it's not my top choice. I would say stay away from it. And
Okay.
so because it's important for those meds to work, given the
Sure.
severity of his health issue. And so the second one I would probably go to is Shazandra.
Okay.
And I would give him like 2 to 3 drops, like right as he's going to bed, maybe
Mean
15
internally?
minutes. Yeah, I would do it internally, and it will improve the quality of sleep and usually helps them to stay asleep longer and stay in some of the deeper levels of sleep for a longer period of time.
Okay. And the other question is, do you take should we take 4 different oils for the 4 stages of sleep?
Well, you're not doing any of those internal, but you're like the thing with what we did in Saturday with the lymphatic 5 and the 4 stages of sleep. It's not necessarily what you're going to do to try to fall asleep every night, but it's unwinding the agitation that can cause each one of those stages to be like dysfunctional. So from time to time, if he's up to it, I'd just run him through that last. You don't even have to do the first part. You can just go through and do those 4 stages of sleep, run him through those 4 protocols, maybe 20-minute little session with him. And maybe do it once or twice, and then whatever he uses to go to sleep, or sometimes without even using something, the sleep quality improves even weeks after you've done that protocol.
Hmm.
And so the idea is to unwind the agitation. He's been through having the heart that needed the surgery and then the surgeries themselves. So there is going to be a significant amount of agitation and his nervous system, and his physiology that just needs to be undone so that he can get to those deeper stages of sleep. Like the reason why we have harder time to get to sleep as we get older is that agitation never goes away. It just keeps accumulating. And so at some point, if you can go through and re-educate that and release that, you can kind of go back to sleeping like you did when you're a bit younger. And so I mean, I've even treated kids and teenagers where they were already having really bad bouts of insomnia, and doing a version of what we did on the end of the day on Saturday with those 4 stages helps to unwind that.
Okay. All right. I know that at one point, maybe a year or so ago, you said to alternate, I guess, Artemisia and mugwort, because one
Yeah.
was more, and when I wasn't quite sure what you meant. Did you mean like inhale one and then inhale the
Yeah.
other at the same?
Like you're kind of just going like,
Oh, okay.
2 or 3 inhalations, and then 2 or 3 I'd probably do more like 4 or 5, and
Uh-huh.
then just keep going back and forth, because you're hitting the later stages of the non-REM, and then you're hitting REM by using the two different, Artemisia and mugwort.
Mhm. Okay.
And so it does help like those deeper stages,
Mhm.
but that could be a thing that he does, you know, on a nightly basis as he goes to bed. You know, we've had several people who have the Fitbits and, you know, the different kinds of like, you know, Apple Watch and things where they go through and monitor it, and going through and doing that process has extended the time they're in deeper levels of sleep by even just doing that process.
Oh, good,
You know?
good.
And if
good.
you look at the last couple of phases of that, the sleep components and the lymphatic 5 class, that mugwort and artemisia is still there, but there was a couple other options that will also work.
Okay, thank you so much.
You're so welcome. I mean, do that, treat him for a little bit, see how he feels, and then we can make adjustments based on how he's responding
Okay,
and kind of go from there. You know, even though we kind of know these things will work, sometimes people have little anomalies and things that need to be addressed, or you need to do a little troubleshooting. And, you know, let's just like talk it out if he's not responding, or, you know, because any time where the body has gone through something very intense, there's always the potential where it'll take longer for them to respond, or they'll start to have almost like a paradoxical response where they'll start having like an opposite reaction.
mhm.
And so if any of that kind of stuff arises, you know, let's just talk it out and we'll come up with a way to treat it.
Okay, thanks so much.
You're so welcome.
And go ahead, Cindy, then Andrea.
Hey, Cindy,
Hey, Greg.
how are you doing?
Oh my gosh. Okay, I guess. Looking forward to you coming to Birmingham.
Not too far away. Was it like almost 3 weeks away, I think.
And I'm gathering my personal questions. But anyway, so I think I did love the class this weekend. But I may have, you just said something about having a paradoxical
Yeah.
reaction. I'm wondering if I might be having that, because it seems like there's a couple of things going on. Like there's some deep pain in the body. It's almost like it's coming from the bones. But I am doing galbanum.
Like the bones feel achy?
Yes, like it's deep. And
Yeah. That can be also just deep lymphatic stagnation. And so have you used truffle root cleanser anytime recently?
I used to, well, I did some inhalations last night. You know how you said do the frankincense, that whole
Mhm, mhm.
protocol?
Mhm,
I
mhm.
did that protocol with CRC. I probably need to use more.
And I kind of remember like you were having a little bit of this even a few weeks ago, yeah?
Yeah, I was, and it's and when we talked, you said there was some trauma coming out, and it does feel like it's releasing, but it's kind of slow. So so there's that, and in my right arm close to the elbow and my right finger that I use at work for the mouse, the finger is swollen quite a bit, and the arm has a lot of pain, and it's been like that a couple of weeks, but it seems like it gets better, it gets worse, better, worse, because I keep trying to do stuff to make it better. But the swelling is not going away.
Has there been any weird things going on with your skin?
Yeah, you know, I have psoriasis. That's the only thing I can think of.
Has it been worse like over the last month or two?
it's starting to get worse, and I'm like,
Okay,
oh my
so
God.
let's have you put some spikenard on the psoriasis. Let's have you do a little ginger for your gut. Let's just, ginger being like non-specific, it's just going to help. It's not too stimulating, it's not too sedating, it's just kind of helps everything function better in the gut.
Inter-
Yeah,
internal.
internal, like 2 or 3 drops. Like I would use chocolate root cleanser for moving the lymph. You are having a bit of some inflammatory responses. The bone pain, that's usually like really deep lymphatic stagnation. And
It could
it's,
be.
yeah,
It could
and it's like the blockages are almost like right by the bone. And so there's this herb called bonaset, like bone and set. And honestly, I think if you go to Golden Temple, like I think they have it, there's that little section where they got those weird old school herbs. They're
I
in that
do.
green and white label. They
Yep.
probably have that there. But if they don't, go online, go on Amazon, just order Bonaset and get it in capsule, not in a tincture or anything. Get capsules. Take like 2 or 3 capsules of that. It does several things, but one of the things that it's really super good for is that deep lymphatic stagnation that causes achiness in the bones.
Okay. I think you're right about that, because every time I do the lymphatic, there's a lot of pain in the body, but it does
Yeah.
go away. It
Yeah.
goes away.
It's probably, there's something probably detoxing, or when you do the lymphatic work, it might start detoxing some areas, but things that maybe were degenerating or really stagnant as far as their function, it does start cleaning those things up. And as the function improves, sometimes you just got to keep it moving, keep it going, because it's like kicking off the stagnation or the blockages or the degeneration that's happened. And so you just want to keep everything moving. It could be that you're tapping into something like that, and some of the inflammatory material is kind of hitting the body and hitting, like joints and things like that. And so, are you taking anything that's herbal that's for your sleep?
Every once in a while, but nothing regular. There's remember Joanna and Trevor?
Oh yeah. Yeah.
They have a sleep remedy, and it's really good, but it's in a tincture, so I don't take it too often.
Make sure you don't take any 5-HTP. Make sure it doesn't have, I can't remember what 5-HTP is, something standardized from an African herb, and I can't remember what the name of it is. But most times when you get it in the health food store, they just call it 5-HTP.
Right.
The thing with that is just for a little while, but when there's inflammatory stuff being processed in the body and you take 5-HTP, it makes for some weird reason, it makes the lymphatic system, if the lymphatic system's a little overloaded, it makes the lymphatic system dump what it's carrying. And all of a sudden, all this inflammatory material will just hit the body. And so just make sure there's no 5-HTP. That if they're growing stuff, I doubt it's got it in there. But just for some reason, stay away from the 5-HTP for a few months.
Okay. So to keep things moving, can I do the CRC inhalations with that protocol?
Yeah. Inhalation, just kind of wherever you feel it in your body, like wherever you're feeling something kind of weird, like do something like that. Reducing inflammation, you can do black cumin or black seed from the health food store. You could do that for a period of time. If you really need to clean things up, German chamomile taken internally is very good for reducing inflammation, but it also does kind of like a metabolic cleanup, like from the inflammatory material or the infection or whatever might be going on. It's just that you can't take that for super long periods of time. You know, you could take it like 3 weeks and then take like a week off, but then you can go. What's that?
How many drops?
Probably 3.
Okay.
And you could also put that on topically. Like, you know, you can do a little bit internally, but topically you can use it a lot longer. But internally, it's very stimulating to the immune system, and you don't want to over agitate the immune system. And sometimes things like yarrow or German chamomile taken over a long period of time can reduce the absorption of iron in the body. And so, you know, we don't need to be causing things like that.
Okay, and I have one more thing.
Yeah, sure.
That sounds really good. So at work, I always have lots of material at work to work on. just to keep things interesting, I guess.
Right.
Oh my gosh. So there's a manager that I work with, and it was really good to work with him at first because I wasn't doing anything. And I could give him all this attention, and he always makes you do the work 2 or 3 times and, you know, drag it out because of his issues, right?
Is it his
So-
issues, or that he wants to like look busy, or like what is it?
I don't think he wants, I'm really not 100% sure what's going on with him. He's kind of ADHD, and he does travel a lot, to be fair. But he's always behind on all of his work. He doesn't like detailed stuff, and his work is, a lot of it's detailed. And so I'll work with him on something, and then he'll realize, and I get it all done, and then he goes, oh, he changes the whole thing because he left out part of it. Then I have to do it again because he forgot, or he left it out, or who knows what's going on in his mind. And occasionally, you know, it might be the owner of the property that caused that, but I'm thinking it's him, just based on how he is.
Okay, so this is what I'd say about this. We'll step away from the use of oils. I don't know that oils will resolve any of that with him unless you hold him down and throw a bunch of oil down his throat. So
No, what I'm asking is, how do I keep me from getting upset?
yeah.
Yeah, I mean,
I would say,
how he is.
boy, it's a Melissa night. I would say Melissa would probably help that. But before we even go down the Melissa road, let's think of it like this. You know how, like, you might be talking to somebody and you go, yeah, and then there's this, and then there's this, and then there's this, and then there's this, and then there's this. What do you think? And the person goes, and then they answer you. They need that moment to kind of process what's just being said, because they're kind of processing it. They're not doing it. He does that on a much bigger scale. Much bigger scale. Like he's like when he's kind of giving you this, or he gets, and he's like, well, like, we got to do this different. We got to do this different. It's literally him going, okay, I have to form this, pull this together, and then give it to you. So this is what I would start doing. Like, give him a little bit extra time to process. And then, you know, like in the politest way you can, go, you know, the other day you said there was another piece. He never said it.
Oh, no, he never tells me.
No, but like, say that to him so it makes him think about, am I missing something? and go, yeah, I wasn't sure. You kind of mentioned it, or I saw it on a paper or something. Give him the time to process it more and give you the piece that he's left out. You see what I'm saying?
I'm gonna have to process that one.
Yeah. He's forgetting something because he's going, but on a bigger scale, like not just in a conversation with his workload. And so, he's forgetting something. So create something so that he can think about it again and go, oh yeah, I left out this whole piece. But don't make it about like you're leaving a piece out, because he'll get defensive. Go,
Yeah.
you said something like there was another piece to this, because it won't make him defensive, and you're giving him the opportunity to be successful. You know what I mean? You're not saying you screwed up, you didn't give me everything. You're like, you said something, I can't remember. Do you remember what it was? And then even if you walk away and he hasn't given it to you, he'll be thinking about that and he'll probably figure it out much faster. Does that
Okay.
make sense?
I have to think about that some, because he's really difficult. And he doesn't mean to be. He's not, it's not about like he's trying to be difficult.
But when somebody kind of is caught off guard or they don't know what they're doing, the tendency is to be aggressive.
Yeah, okay,
Like,
I got
yeah.
it. I
So
got
you're trying to take away the reason why he's being aggressive or why he's being dismissive.
it. Okay.
You know what I mean?
see
You're
that.
creating an opportunity for him to give you that extra piece of information without it being you pushing for it, or I need it, or I need a deadline, and, by saying it to him, like, the other day you were saying something, or we talked about this, or I saw it on a piece of paper or something that we were shuffling around. It allows him to feel smart.
Okay. I do
He's a
see
guy.
what you're
We need stuff like that sometimes. Like, you just got to let him like be the, how like you come up and you give somebody this really great idea and they'll go, no. And then 3 days later they go, I had this amazing new idea. And it's your idea. It's a form of that.
Yeah, he does need to feel good. You're right.
Yeah. Yeah. He is what he is. You know what I mean?
I do totally understand that part about it.
Yeah. Yeah.
Okay.
You
Well,
know, like,
that's helpful.
sometimes, think of it like a computer. Like sometimes you need to put in the right code and ask the right questions to get the result you want. He's just that. You just have to communicate with him in a way that makes your life not as crazy. He's the one making it crazy. So like, what do I have to say to this guy to make him not as, causing chaos in my life or causing me to do the thing twice or whatever it is. And he's just not processing everything at once.
Yeah, and he does have a lot. He
Yeah.
does. That's just
Yeah.
his job is. Okay, well, I'm going to work on that one. Thank you.
Yeah. Then Cindy, this will probably help. His ajna is not very big. You know what I mean?
Okay.
You know what I mean? Like, he can't strategically think or need to, he sees details, but he sees just pieces of it.
He can't pull it all together.
No.
Yeah,
So that's why you gotta help him pull it together to make your
Okay.
life better. You're not trying to make his life better.
No, right.
Even though you're dumb, you're doing it like this and being polite, it's going to make him work more. Like, in the moment, he's trying to be dismissive of the work at the time. So by going through and doing this, you're making him work a little bit more, but it's going to make your life much better.
Yeah, that's what I want, my life
Yeah.
better.
Yeah. Well, it's more efficient for the company too. It's not just about your thing. Your time's valuable to be spinning around with doing something 2 or 3 times or having to go back and forth and keep getting bits and pieces of information.
That's
Not
it.
great
That's
for
it.
you. Yeah, it's not great for you. It's not great for the company. It's not great for efficiency. I mean, you know, that's not something that you could address with him. That would have to be somebody who's his boss would have to address with him. And even then, my experience in the corporate setting, a lot of times they'll listen and then get a little bit more passive aggressive. Not every time, but sometimes. And so
Oh,
I would do this in a really soft way.
yeah, I can't say anything to anybody.
No.
That's why I'm talking
No.
to you about it.
But even if it wasn't coming from you or you telling on people and the boss got wind of it and said, hey, you know what, we need to address this. And the boss had a little conversation with him about it. He might be better for like a week and then he'll be worse after that.
Yeah, he's gotten mad with
Yeah.
a couple of
Yeah.
people, and he is hot
Yeah.
with them. And
Yeah.
and it isn't their fault.
No, it's him.
him.
Yeah,
It's him. I'm
Yeah,
like,
yeah.
I'm just like, I'm astounded.
Yeah.
That is very helpful. Thank you.
Yeah.
Mhm.
Make it a game. How can I get the information out of him? Like what's my little approach? Think of a couple different things that work and then, just throw them out there. I saw it on some paperwork. You said something to me, because that means like, oh, he was smart enough to know it. So then he's going to try to recall it because he wants to show that he's smart. That's
Right,
a really great one to use.
I like that one. And you're
Even
right.
when you know that that's being done to you, you still go, yeah, but I'm going to figure it out. Like, you know what I mean? Like,
Yeah.
it works.
I can see where that would work with him.
Mhm.
Thank you.
And go ahead, Andrea, then Jan.
Andrea.
Let's get you unmuted.
That was absolutely fascinating discourse on all that Cindy had to say. I have some more mundane type questions.
Mhm.
One is, what do I do that's useful and practical with all the little empty oil bottles I have now?
Oh, you could save them for like, if you want to make like a little travel thing, or if you have a client or a friend you want to give something to, you can clean them out with a little bit of rubbing alcohol or something. Yeah.
Okay,
Yeah. Other than that, boy, I don't know.
yeah. They're pretty small to put in the.
They're pretty small. Yeah.
Yeah, but it seems wasteful just to.
I know.
I'm
Like,
one of those. Use it again or use it
Yeah.
somehow. Okay, thank you on that. So then I have a client who has autoimmune issues, and there was some other reason that I had recommended to her to use 3 wise men, and she had read on your site that it strengthens the immune system. So I would like just a few guidelines on.
Yeah, it shouldn't make an autoimmune issue like worse. Like, there's some things that are really like stimulating. It's like it's strengthening to the immune system, but more like fortifying, because like even if you take something like cinnamon, which is very stimulating to the immune system, even when somebody has an autoimmune issue, they can still take it. You just have to drop the dosage, and you can increase the frequency. And so I don't talk about that too much, just because, I don't want people to overdo it or something like that. But Moroccan thyme is always good for somebody with autoimmune type issues. Melissa can be good. Apparently tonight is the night about Melissa. Melissa can be good, but even vetiver can be, vetiver or ruscus can be very nice for autoimmune type related issues. Do we know what kind of autoimmune type?
Well, I didn't, my awareness of her whole situation is limited. So she has MS. Is that autoimmune? Is that what she's talking about? I hadn't thought of
She's
it.
probably like testing for the MS and everything. They probably have found that she has some markers for autoimmune.
Okay.
I'm getting a little bit of a vibe that there's a component of the autoimmune response that goes after mucous membranes. And the tendency is for like the eyes to be dry, the mouth to be dry, the lungs to be dry, you know, the sinuses to be dry, even the digestive tract. And I'd ask her about that, you know, if it's not the case, but if it is the case, Shazandra would be super helpful for that.
Okay, yes.
But you know, going back to the three wise men,
Mhm.
I would say instead of three wise men, you still can treat the endocrine system, but use lemon verbena. And the reason being, lemon verbena is still a tonic for the endocrine system, but in Europe, they use lemon verbena to treat some of the symptoms for MS. And
Ah,
it doesn't really like, it's one of those weird things where it really doesn't treat the MS itself, but it treats some of the symptoms and is like calming and soothing and can be very relaxing and kind of help get them out of like like I don't want to say crisis state, but you know, when the MS is a bit more active and it starts nudging them more to a state where there's a greater potential for remission. And so I would go kind of hard on the lemon verbena.
okay.
Like 2-3 drops internally. I mean, they could do a little bit more, but I'd start them off at 2-3 drops just to make sure they feel comfortable, but they could easily double that, like do it just like twice a day
Mhm.
if it's working for them. I would do that instead of the three wise men. The three wise men will still work, but just
Yeah.
because of the MS, I would say, yeah. And then just things that are calming and soothing to their body.
Mhm.
Things like marjoram and you know, things that just take tension out of their body. And you know, you're doing healings and things like that, but like sometimes when they're in a crisis, even a little bit of body work can help them, but not necessarily like massages and things where there's like compression for like 3 to 5 seconds and then release and then compression and release. And what that does is it calms down the nervous system.
Mm.
And you know, like even, well, just anywhere on the body where they're having like those issues, that type of body work where they would compress and then release. And so there's different kinds of body work that potentially could do that, but rubbing, it doesn't bring a lot of relief, but the compression and then release, that kind of helps to re-educate those nerves. You're not going to make it go away, but at one point, like I'd say 30 years ago or so, the MS Society even recognized certain forms of therapy that involved compression and release as a form of reducing symptoms. It didn't cure anything, it didn't do anything, but it just reduced some symptoms. And so
Do you know of any of the therapies that?
like there's one called like I wanted to call it Tuina or Tuna, like Tuina, and then like shiatsu, Some neuromuscular therapies can do some forms of that.
Okay.
Every once in a while, there's certain types of sports massage that they'll do something like that, but it's usually mixed in with a bunch of rubbing. And so the rubbing doesn't hurt. It's just, it doesn't help a whole lot. Like
Yeah.
the compression is actually what helps.
Mm.
I mean, even getting one of those like little compression guns and then having them like do it on their body. I mean, those things can be helpful in those situations because it's, you know, it's compressing faster than 3 to 5 seconds, but it's still compression. And so it will help reduce symptoms a little bit.
Would you turn it down so it's not real powerful or?
Whatever they're comfortable with. Like sometimes people are very highly sensitive and sometimes you can stand on the person, they'd go harder, you know, it kind of depends on the person.
Yeah, okay. And then my second question is regarding Bell's palsy.
Mhm.
And is there a protocol that you have for that?
Yeah, so with Bell's palsy, a lot of times there's a compression on the nerve, like kind of behind the ear right back here.
Yeah.
Like you kind of see where I'm at. And so usually I have people use something like rosemary or marjoram and like rub it on the spot and rub it in the jaw. And you even can put like a little bit of like oil that you'd put on the face or aloe vera with a drop or two of it and kind of rub it on the face. But really the areas like the jaw and behind the ear. And if you rub it in like that, it can reduce that quite a bit. And you know, sometimes they'll bounce out of it in like a week or two, and sometimes it'll take a year or two. Like it can take a while. I would also do healing in that area, like really kind of unwind it because the nerve is being compressed, right?
Okay.
So like the more you loosen that area up behind the ear, the more likely they are going to snap out of it, you know, because anytime, like if this is a nerve and if I stick like a nickel on it, you know, if like this was an exposed nerve and I put a nickel on it, it's a moderate amount of pressure, which will excite the nerve, right?
Mhm.
But if I took that nickel away and I put a quarter, you know, not that much more weight, you know, something a little bit heavier, maybe a 50-cent piece, and put it on there, the nerve will go to sleep. And so what's happening with Bell's palsy is that part of the face is like going to sleep. And so you just need to unwind that a bit so that the nerve starts firing again. It's like when you sit on your foot and your foot goes to sleep.
Yeah.
Same idea.
So she actually had, this client actually had this condition about 2 years ago, and her face has recovered quite well, but she says she still has a crooked smile and
Yeah.
her face
Yeah.
sags. So this still would apply to that.
Yeah.
To help.
It probably has never been completely resolved. Like
Yeah.
it resolved somewhat, but like you said, there's the crooked smile. The other thing, do you see him in person or you see him like at a distance?
I have not ever seen her. We did one treatment, and because she's self-diagnosed as autoimmune because all of her joints hurt now, and she has been walking with a cane recently. So we just did a really good pranic healing general cleanup, cleaned all the chakras, cleaned all the joint chakras, and scrubbed out the joints. Left hip was the one that was giving her the most fits, and her big toe on the right foot. So we really scrubbed those joints out. And then
Does she walk with a limp?
yes, she does.
Has she had her hips x-rayed?
Pardon?
Has she had her hips x-rayed?
Probably not.
So what can happen sometimes is like if a knee or a hip is bone on bone, you know, they'll be able to manage it, but what happens is the lymphatic system gets really backed up or stagnant in that particular area. And then at some point that inflammatory material becomes systemic. Like instead of being in a localized area, it just spreads through the body. And that's one of the symptoms is the joints start aching really bad, like old injuries start hurting, you know, things that were unresolved years ago kind of start coming back because that inflammatory material is settling in those compromised areas. And so I'd look at like if she has like a hip or a knee, it's usually a weight bearing joint.
Okay.
So knees and hips are the two things to really look at. But if you see like an abnormal gait where there's a little bit of a limp, good chance it's probably a hip, especially if they kind of are swinging one of the legs. You know, they'll walk normal with one and then kind of swing the other one. Something's going on with the hip.
Okay.
And so that even the hip will manifest as low back pain and L2, L3 area, you know, not quite right at the bottom of the spine, but just a little bit up, like just a little bit below the Mingmen.
Okay.
And so, I mean, I'd look at that. And then the other thing is if you ever are able to Zoom with her, like, you know how, like, you see, I'm sitting here like this. See if she sits like this.
Okay.
You know what I mean? Like her eyes aren't horizontal.
Okay.
And that actually, you know, going back to the Bell's palsy, is that there can be some issues in the cervical spine that is basically, it's like a condition that it's got a funny name, but it just means twisted neck. And their neck, like they'll always, like even when they're walking or talking, their head will always be off to the same side, like all the time. Like the eyes won't be horizontal. And in more extreme cases, they'll start to have a little bit of a tick, like where they kind of go like this, and then they'll go. If that's the case, you have to really treat the neck, like the vertebrae by vertebrae. You have to really unwind the neck. They can develop Bell's palsy if that happens, but that is an autoimmune issue. Like that causes autoimmune issues, and so.
So that triggers an autoimmune
Yeah,
issue.
anytime, like if this is the vertebrae and it moves side to side, it impacts lymphatic function. It just slows down lymphatic movement in the body. But if the vertebrae slides forward, it's autoimmune almost immediately.
Okay.
And so what happens sometimes in the neck is one of the vertebrae will just slide a little bit forward, and then it causes this autoimmune condition. And you know, a lot of it's in the neck and in the face, but I mean, hopefully it's just straightforward Bell's palsy, but that she's having some of these other symptoms. And I would just like have a look at her and not like try to hold yourself straight, like don't say anything to her, and just like watch her, like her movement. And like when she's resting, if her head starts always kicking off to the side, that's torticollis.
Okay. She's a brand new client and we've had only one session, and I basically said, okay, we've done something, just sit with it for a week or two and then call me back and we'll go from there. And she contacted me 3 days later and said, I want to set up another appointment.
Oh, good.
She said, I want to address Bell's palsy. And so then I said, I have to talk to Greg.
Yeah, sure. Like so treat along the base of the skull, treat the ear, treat the jaw, you know, little marjoram or rosemary, just one of them. It doesn't have to be anything crazy, but all of that should help unwind it. But that she's having some of those other symptoms, it always makes me want to go, oh, feels like something else is going on too. Like if she just responds to the treatment and she starts getting better, I'd almost forget everything that I said, other than, you know, check the hip, check the jaw, you know, do the base of the skull, and probably call it good. But anytime you see joint pain, there's lymphatic stagnation, and you know, you mentioned that she was walking with a cane and stuff like that. That starts to have a little bit of a vibe of something going on in a hip or in a knee, and then that can cause systemic lymphatic issues and systemic inflammation in the body. And then you start factoring in those other things, and
So, yeah, she didn't have any amazing thing happen with that. She
yeah,
said,
if
Well-
it's systemic lymphatic issues, it's going to be hard to control. Like
well,
it's doable, but it's not going to happen overnight.
what I actually thought of was asking her if she would like to be part of an experiment and just take her one session per week and go through the whole lymphatic protocols that we've had
Yeah,
so far.
I think that's a great idea.
Because it would really it won't hurt her at all.
No.
And it would be a great tool to see how that all unwinds
Yeah.
things. And I'm
Yeah.
sure that she's just, well, most of us are pretty stagnant, but I'm sure.
Yeah,
she-
the lymphatic system is I think it's one of the most undertreated systems in the body.
Yeah,
One of the most vulnerable, and at the same time, one of the most undertreated.
yeah. Thank you so.
You're so welcome. Keep me posted on that. I'm very, very curious.
Yes, and just a footnote, long ago, you helped me with a client who was having really bad headache, constant, since the time her roommate blew up at her. And so I did what you said, and she has continued to use the oils, and she emailed me the other day. I hadn't heard from her for quite a while, and she said, I don't have headaches at all anymore.
Oh, good.
Yeah.
Good,
Okay.
Good.
Thank you.
That always makes me happy.
Oh, it made me happy, and I knew you'd want to know.
Yeah.
Take care.
Take care. Oh, one more thing, Andrea. Anytime you want to, going back to pH, fill her lungs up with like green and orange for
Yeah.
a long time, and it will help move the lymph in her body. Like,
Okay, this is-
anything you put in the lungs will spread out through the whole body.
Yeah.
And the orange will really help the
Yeah.
lymph to move.
Okay, I'd never thought of that for the
Yeah.
lymphatic thing. That
Yeah,
sounds
yeah.
great. Oh, yeah, that's for the Bell's palsy person.
Mhm.
Right.
Mhm,
Actually good for everybody, right?
mhm, mhm.
Thank you. Thank you so much.
And then go ahead, Jan, then Laura.
Hey, Jen.
Hi, my main question is going to be about bone on bone knee pain.
Okay.
But I just wanted to say real quick that Saturday after the sleep class, I had the best sleep I've had in years.
Yay. I
Yeah.
love that. I'm trying
So
to generate the good karma for me to have some good sleep.
yeah, it was great. So I have osteoarthritis.
Uh-huh.
Both my knees are bone on bone and have been for over 20 years probably.
Okay.
And I'm pretty bow-legged, so the inside of my knee
Gotcha.
cartilage, wore out
Yeah.
first.
Yeah.
And anyway, I don't want to have knee replacements.
I don't blame you.
Yeah, and so
How much swelling is there in the knees?
there's quite a bit. They're pretty swollen.
So I would do a thing where there's a blend called joint relief.
Right.
And joint relief is like rosemary and like cedar and some pine and juniper and a little bit of ginger. And it's a very old formula. It's actually a several 100-year-old formula, and it's used to treat specifically osteoarthritis and rheumatoid arthritis.
Mhm.
And the goal is to keep blood in the area and to get the blood to move out of the area. And when we have arthritic conditions like this, the blood gets really sluggish in these areas, and there can be a lot of spasms and things that continue to reduce flow. And
Mhm.
so I would use that. And instead of, if that's a lane that you want to go down, instead of just buying like the little 5 or 10 ml bottle of it, I would suggest we make it into an ointment, so it's oil based. And in the ointment, I also put in sesame oil that's had a licorice root soaking in it for a while. It's called a maceration. So it's not an essential oil, but it's an herbal like extract. And the thing with the licorice root is it also has a bit of a steroid effect on the area. And it can help reduce the inflammation, can help reduce the pain. So that combination works very good. Then I would say a liniment or just the straight essential oil of German chamomile. German chamomile will be anti-inflammatory. It will help to disperse the fluid that's accumulated in that area. And it has like a bit of a cleanup effect of like the metabolic waste and things that comes from the inflammation in that area.
Yeah.
And then, so I would do those two things. And then I would put probably like 2 or 3 drops of Sylvester pine on the wrist.
Okay.
And the thing with Sylvester pine is that it helps elevate the production of cortisone in the body, which will again reduce inflammation and will reduce some of the pain. And we could keep going down the rabbit hole and easing some of the pain, but I would say those 3 things right there are very immediate to reducing the symptoms that go with bone on bone situations. So sometimes I do have people also use galbanum just to help reduce pain and the tension in the body from the pain. But I would say joint relief, some German chamomile, and Sylvester pine, those would be my very first go-to things for that condition.
Okay, great. Yeah, a doctor told me recently that on the x-rays, he saw a lot of calcium deposits.
Yeah.
Kind of above my knee. So is that the kind of thing that the lovage leaf?
Well, the lovage would help, the arthrocare would help. And if it's just kind of deposits, sometimes the lovage will help flush that out. If it's calcium deposits, they're kind of like these little like pointy things that will dig into the tissue. The lovage will help like unhook the calcium deposits in that area and slow down the production of the calcium. Like it will keep flushing some of the calcium deposits out. It might not break down the old calcium deposits if they've really calcified, but it will unhook the tissue from it and prevent more stuff from settling in that area.
Okay. Well, that's great. I have some joint relief ointment from a class about a year ago. And
Oh,
so
perfect. Yeah,
I'll fix
start
that.
slapping that on there. Yeah.
and Order some more and
Yeah.
let's see, yeah, German chamomile and Sylvester pine. And and then as far as breaking the calcium, the lovage.
Either lovage or arthrocare. Either way.
Okay.
Yeah. I mean, arthrocare has got a bunch of lovage with a few other things in it. So either way, you're kind of doing something very similar. Yeah.
And those would just be topical.
Yeah, topical. Yeah,
Yeah.
just topical. Yeah.
Okay, great. I will do that. Thank you so much.
You're so welcome. Keep us posted.
Okay, thank you.
And then go ahead, Laura.
Hey, Laura.
Hi, Greg. The human design class was really good. Thank you.
Oh, today? Yeah, earlier
yeah.
today.
Yeah, thank you. I have a question about the arthocare that you were just talking about.
Sure.
Would you just do this, the oil directly on it, or would you get an ointment or a liniment, make liniment or
You
what?
could do it either way. Sometimes like if I make it in a liniment, I add golden seal to it, which is a lymphatic stimulant. If I make it into an ointment, I'm trying to remember what I use on that. I want to say I use Gotu Kola as the like a sesame oil and Gotu Kola in that that I add the arthocare to. And the reason being it helps move the blood and lymph from that area. So it helps with the flushing effect, you know, flushing things out of the joint.
Great. Okay, my question is, I was with friends this weekend for a wedding and talking about having neuropathy. And so I wanted to see if there's something that you would suggest for that.
Yeah, so with neuropathy, you want to kind of I mean, neuropathy can have a couple different causes, but like the first thing you kind of do is you use like venous tonics on, I assume we're talking down in the feet.
Yes.
Okay, so you want to use some venous tonics to move the blood and lymph up out of the legs. Because if you look at somebody who has neuropathy, a lot of times the veins in their legs are really big and bulging, right? And so there's a lot of stagnant blood and lymph down in the legs. I would try to move that up and out of the area. And a lot of times that will reduce the neuropathy quite substantially. And, you know, we're talking about Gotu Kola topically. I usually have them take Gotu Kola capsules internally. You know, you can just get them any health food store, go on Amazon, like probably 2 or 3 capsules a day. You could double or triple that if you needed to, but 2 to 3 is probably pretty solid. And that combination, it doesn't make the neuropathy completely go away, but it reduces it usually quite substantially.
So did you say a venous tonic or?
Yeah, so
or
venous tonic could be lovage, could be like cedars, um, even like the orange healer blend, you know, that could be a venous tonic. Anything, even the joint relief to a certain extent is a venous tonic. You know, it has a lot of things that move blood back to the heart. And so you're not wanting to get blood to the area, you want blood to leave the area. And so you know, sandalwood's a venous tonic, but it's expensive. Like cedar is cheap. Like I would use a bunch of cedar, I would use lovage, I would use things of that nature just to flush things out of the legs.
So if I were to place an order through you, could you mix like the lovage and the cedars for some kind of an
Yeah,
ointment?
you honestly, you could probably get away with just cedar. Like we make a strong cedar liniment and
Okay.
it would reduce the costs and it works pretty darn good.
Okay.
Yeah,
I
I'm
will
glad to
do
mix
that.
it for you, but it might just get done with the cedar.
Okay, that's
Yeah.
perfect.
Yeah.
Thank you so much.
You're so welcome.
And then I think we just have one question in the chat.
Mhm.
What is the difference between the upcoming class mystical approach to psychic protection and the class you already taught, that psychic protection class?
Oh, the old one?
Yeah.
So the psychic protection class is a way to like strengthen your field. Like as somebody is projecting negativity towards you, you know, you got a boss or a family member and they're like, you know, saying obnoxious things or just thinking really, you know, hostile or aggressive things, or they have the tendency to kind of just like have a little bit of a meltdown. The thing with the mystical approach is it's not really about strengthening your energy body and like kind of building like a denseness in the energy body like that acts like a shield. It actually helps to shift the brain And because a lot of this stuff is it's having an impression on the psyche. And so a lot of times what happens when somebody projects something towards you, the projection is over actually kind of quickly. The difficulty is the impression that it's left on the psyche, even though you might not be aware of it. And so this is about soothing agitation in different parts of the brain that are specific to when those things happen, because manipulation hits the psyche and the brain differently than aggression, differently than violence, differently than somebody being judgmental or snooty, or, you know, whatever you want to call it, different than racism, you know, different than, you know, all these kinds of things. So each part of the brain potentially can have a sort of agitation. If you calm down this agitation, then what happens is when they project, your body becomes non-reactive, and there's not the bouncing back and forth between the bodies. You know, if somebody comes in and says, you know, you're a horrible person for these 10 reasons, you know, part of it has an impression on the psyche, but that aggressive energy or that violent energy starts a bouncing back and forth between their energy body and your energy body, and your energy body, even after they leave, keeps like trying to defend itself. It's a way to just calm all that down. So you're basically taking away the Velcro so that things don't stick. Where the old class was about hardening things up so it can't penetrate, this one is like, even if it gets through, it doesn't stick. And even if you didn't strengthen your energy body, it still just doesn't stick. And so, you know, times like when you get triggered or you feel a little bit uneasy, or things, you know, you get easily agitated when somebody's being aggressive towards you. Part of it is there's this agitation in the different parts of the brain that cause you to have these reactions. And so the byproduct is that even when somebody's being like that, you're just like, you're kind of relaxed. You're not really defensive or agitated or trying to like justify it or make sense out of what you're doing. You're just like, okay, I guess you're just upset. Like, you know, it calms everything down. Even if you get a little agitated, you pull out of it much faster. Like instead of days, it's like an hour or two. Yeah. Mhm.
Great.
Yeah. So is that it? We're good?
Yeah, good.
Okay. So we have a little bit of time. Let's talk depression. Let's do, I mean, there's a lot of different ways to treat depression, but let's pull out oil. I'll give you a list. Camphor, any sort of chamomile, lavender, any sort of thyme, cinnamon, sage, geranium, rose, and Brit. Let's start with those and see what people have. Depression. Now, depression, there's two kinds. There is the physical type, which is the body is very depleted, the body is very worn down, and you don't basically have the energy or emotions or the energy to feel with emotions, or the mind becomes a little sluggish. And then there's psychological depression, which usually means that there's something upsetting, something maybe causing you to be angry, and it might not be safe, or you might not feel heard, or it's scary to bring it out, or it's just down deep and you're not even quite sure what it is. So if it's more psychological, things like rose and Brit, sage, or cinnamon work really well. But what we're doing here, like if you can't differentiate, it should help with any of them. You know, it might take a while, but here we're just going to do inhalation. We're not going to do anything internal, but it should be quite helpful. Okay, so there's a couple areas that we want to look at, right? One is you just want to do inhalations into the body, right, which we'll practice, but there's areas that we want to look at, and one is usually the spleen is very depleted. Now, one of the ways to strengthen the spleen is also to strengthen the navel, right? So what we're going to do is, you don't really need to think about anything, but just start whatever oil you're using, start inhaling, and your awareness is just in your body. Just explore your body, inhale the oils, let the oil kind of come into the body and have its impact. You're still taking nice, long, slow, deep breaths. You're still taking long, slow, deep breaths. Move your awareness down to the navel. You're taking nice, long, slow, deep breaths with your awareness on the navel. And then just pause for a moment and just be still. Keep your eyes closed, just let it incubate. Begin inhaling again. Your awareness is on the navel. You're taking nice, long, slow, deep breaths. Your awareness is on the navel. And move your awareness 1.5 inches below your navel. Nice, long, slow, deep breaths. Just be still. Begin inhaling again. Your awareness is on the left side of your body below the ribs. Your awareness is on the spleen. Move through the body to the backside on that same spot, the back spleen. And then just be still. Just let go and be still. Your awareness is on your palms. You're taking nice, long, slow, deep breaths with your awareness on the palms. And just be still. Just be still. Just be still. Begin inhaling. Your awareness is on the soles of your feet. Nice, long, slow, deep breaths. Just be still. Just be still. Be aware. Take some long, slow, deep breaths with your awareness just on the lungs. Move your awareness to the back heart. You're still inhaling. Just be still. Now go to your brain. Inhale with your awareness on your brain. You're still inhaling on your brain. And then pause. And this is what I like to do with this. You know, we're just kind of going through and hitting the spots that contribute to depression in the energy body. But if there's a feeling that is strong, like I feel like something, fill in the blank, or there's thoughts that arise, whatever it is, a feeling or a thought, put your awareness on that and begin inhaling. And then just be still. Notice your body. How do you feel? We have a few minutes, not many, but we have a few before we move over to Astara and do the prayer petition blessing, which please join us if you can. It's just a little 15-minute thing, but we get together as a community and bless. But let's share an experience or two. We'll just do whatever we have time for.
You can unmute yourself. You can also just type in any kind of experience as well.
And maybe put the link in for Astara right now. So we're going to post the link for Astara right now if you want to join us. So you can just click on it and pop right over to that. It's a nice way to just kind of flush things out. But go ahead, unmute yourself or type in. If there is some depression, I would do this daily, if not even a couple of times a day. Yeah.
I feel like something's coming off of my legs. Like bugs.
Yeah, like sometimes, what we would call energetically as elementals is part of what we're trying to shed from the arms and the legs. They're usually a little bit worse in the legs than in the arms. And so you might be feeling some of that. Yeah. If it gets uncomfortable, jump in a salt bath with like some sage or lavender, something of that nature, and just let the salt and the water kind of pull it off you.
Go ahead, Anne.
Hey, Ann.
Oh, I feel tight in my head and my gut. My partner said tonight as he was going to bed, I really need you now until I get better, until I die. He has a lot of pain that he's dealing with. I think it's lymphatic. I don't know if it's partly physical also, but it was heavy.
So you feel a little bit tight in the gut and you feel a little bit tight in the head?
Correct.
What oil were you using? I'm just curious.
Cinnamon.
Cinnamon. Like her front.
Oh, yeah, yeah.
So yeah, you look like you have a big energetic cord on the front there. I'm having Samantha cut it real quick. And give me just a second here. And then on the throat. How's that feeling in your gut right now?
Loosened. It loosened.
Yeah. So it's just some cords. When you go through and you start increasing your energy, sometimes that stuff kind of happens. And, they're not always malicious. Sometimes it's just, people stressing out or, they need something or they're just not having a good day. And so we'll just go through and clean that up.
He's using a walker now and he's having real trouble moving.
Yeah. God bless him. Like that's got to be hard. So maybe you use like a little etheric cords or ironbark eucalyptus or rue from time to time, even hyssop if you don't have any of those, and just see if that can help clean that up from time to time.
Right. Thank you.
You're so welcome.
Someone's asking, will sadness and grief work too?
Sadness and grief will work if you're sad. If you're not sad, I mean, it wouldn't hurt, but it probably wouldn't be as helpful. Same with ginger lily. That would be more about the grieving process, or, sometimes depression is like you're really sad about something. So in that case, it would help. Yeah. Depression has many faces. It's not always just an emotional thing. A lot of times it could actually just be physical depletion. So, yeah.
Another person said, I feel lighter.
Yeah, lighter. Good. So we're going to move over to a star now. And remember, tomorrow night we have the master healing thing that we do explorations and kind of talk theory and play and experiment. It's kind of my little time to have like experiments with you guys. And then this weekend also is another free class. And so it's on the essentials. It's something that Robert kind of requested, and think of it as like a greatest hits album where we're going to cover all the things that really need to be in place for us to heal or have a nice sense of well-being, physiologically. We're going to talk about deepening the breath and cardiac fatigue and the nervous system. But we'll do protocols, and there's a lot of clinical information in there for you to read. It's not going to be a thing where I clinically lecture a whole bunch, but I'll do a little bit. But there's good reading material for you there as well. So I put a lot of time and effort into it. So hopefully see you either tomorrow night or on the weekend, or maybe in 2 minutes.